My name is April Johnson, and this is the assignment submission for Social Work 510 Presentation and Policy as it relates to substance abuse. The media coverage that supports this is the opioid epidemic. A little bit of background or a brief summary on substance abuse in all forms is a growing problem in the United States. It's not just limited to alcohol, cocaine, or marijuana. The chemical dependency of all of these and a plethora of varieties of narcotics is rapidly growing and almost out of control. Generally, opioids are prescribed by physicians to either relieve chronic pain or after a surgical procedure. The problem is, for some, they become addicted or dependent on it. Some people can't even function without some type of opioid or alcoholic beverage. The misuse of these can be found on the black market, which is also a growing problem because some people are getting medications and are not even taking them. They are selling them for profit, which is causing other people to become addicted to it. Even though marijuana is legal in many states, it's not. I don't believe it's legal for recreational use. It's only legal for medical use, which is why when you go in some of these places, you have to have a medical card to buy marijuana. Substance abuse can cause financial strain on individuals and their families, and in some extreme cases, they can cause mental and physical illness and even death. A current policy related to my story is that of Substance Abuse and Mental Health Services Administration. People living with mental health and substance abuse disorders have problems getting private health insurance. According to the National Institute of Drug Abuse, every day more than 90 Americans die due to the misuse of opioid medication. Next I'm going to talk about how the current policy addresses the targeting social issue. One point is a Sayonara Amendment requires states to enact and enforce laws prohibiting the sale and distribution of tobacco products to anyone under the age of 18. In the workplace, it addresses illegal drug use by federal employees. It certifies drug-free workplace plans and identifies safety by subject employees to random drug testing. The Stop Sober Truth on preventing underage drinking authorized a grant program to prevent and reduce alcohol use amongst youth ages 12 through 20 years of age. These are just some of the laws and regulations related to the SAMHSA organization. And some of the strengths and weaknesses of the current policy. A strength of the SAMHSA program is the Affordable Health Care Act of 2010. It's a federal law that is related to SAMHSA that makes it easier for substance abuse people who are living with substance abuse disorders qualify for health insurance plans under the Mental Health Parity and Addiction Equity Act. Substance abuse disorders must be no more restrictive than the requirements of benefits offered than the medical care, meaning that the substance abuse benefits and the regular health care benefits need to equal the same. They shouldn't lower the type of benefit or make it a decrease in the type of benefit to receive help for substance abuse versus you just going to a doctor's visit or having an overnight stay in the hospital. If an insurance policy does limit their treatments with substance abuse disorders, the goal is to ensure a patient there as a bottom line that there will be no continual support if this behavior continues. That's a weakness of the American Health Care Act, is that they can continually go back and get health insurance coverage for substance abuse. So it's not a bottom line for them. As long as they know that insurance will pay for it, they'll continue to abuse because they know that the benefits will already be there. So that's a weakness for substance abuse disorder in the United States. Then I'm going to discuss a recommendation for policy change. According to the Surgeon General website, it's time that society addresses alcohol and drug disorders in a different way. It's taken an opioid epidemic to catch the attention of federal, state, and local leaders across the country. Some recommendations for policy change to increase prevention and treatment services might include mandating use of prescription drug mentoring programs and eliminating minimal drug sentences. This has been supported by CNN, according to the President Trump, actually declaring that there is an opioid epidemic as a national health emergency. So the country now recognizes there is a problem with substance abuse disorder. Let's discuss how social workers can promote policy change on substance abuse. Social workers have been and likely will always be the primary service providers when it comes to providing services for substance abuse disorders. It is safe to say that their input is necessary in policy change in relation to substance abuse. According to the National Association of Social Workers, public health in the reform of clinical intervention can reduce incarceration rates, improving the health care of communities through education, promoting healthy lifestyles, and researching disease and injury prevention. As I stated before, early in the semester, I do work at a substance abuse facility here in Warrior, Alabama, although I'm from Birmingham, Alabama, and I reside in Birmingham, Alabama. I wanted an actual substance abuse counselor to be able to speak with you all today so she can give you her take on what she thinks social workers can do to promote policy change in substance abuse and mental health. So you're going to hear a few words from my coworker, Miss Natasha Battle, who is a licensed counselor at Bradford Health Services, and she's going to tell you her opinion on what she thinks social workers can do to improve.
Services. I'm a therapist / UR coordinator. I've been in social work. I graduated with a master's in social work in 2009. I got my bachelor's in social work in 2005 from Tuskegee University, my master's from the University of Alabama. So April asked me that question. April, what was the question you asked me?
Oh, what can social workers do to promote policy change for substance abuse?
Okay. And I'm here at Bradford. I work at Bradford, which is a substance abuse facility. But I don't know, just my thoughts on it is, for one, social workers, we're advocates for so many different populations out there. And I just say the biggest thing is social workers need to be advocates. I mean, we need to make sure, for one, we get out there and vote. And for two, we need to be able to get out there and talk to our local governments, get out there, be able to write letters to Congress. But talk to your local government. Pretty much, I look at substance abuse as far as if we can get programs in place for prevention of a lot of different issues that we have going on out there, then that will probably help, prevent a lot of the substance abuse issues that we have today. And so I just think if us as social workers can get out there and advocate for those prevention programs, as far as, more programs out in the school systems, talking to the youth about drugs and alcohol to help them become aware and knowledgeable, and not necessarily just high school seniors, but getting them while they're younger, because as we're finding now, more kids are using drugs and alcohol before they're even teenagers. And so if we can get these prevention programs in place where we get out to the schools and make the kids aware of what these things will do to them, hopefully will be a deterrent. Also, just, get out.
Okay, that was Natasha Battle, substance abuse counselor at Bradford Health Services. I want to thank her for taking the time to help me with my assignment. Thank you all for watching. I'll see you in the discussion boards.